If you play pickleball and are starting to experience pain in your elbow area, look out. You may be coming down with a case of Pickleball Elbow. Hi, this is Alan Willett with the Tennis Elbow Classroom Podcast, and I want to help you get off on the right track, understanding and treating your pickleball injury, whether it's your inner or outer elbow, whether it's golfer's or tennis elbow. More on which is which in a second. Because if you have a tendon injury in your elbow area, it's most likely going to end up being classified as either tennis or golfer's elbow. And I'd like to help you avoid the myths and misconceptions and all the mistakes based on them. Mistakes which derail a lot of sufferers and cause them a great deal of unnecessary suffering. It's no joke. One of my student members who plays pickleball in Arizona, where the sport is apparently very popular, recently told me that half the people he plays with are experiencing elbow pain. Well, maybe not half, but a large percentage of pickleball players are either among the walking wounded, all wrapped up in braces or bands, or they're dropping out of matches like flies. Why are so many getting injured? One theory proposed by my member is that the vibrations involved in hitting that hard plastic pickleball with that hard paddle are considerably more intense than the vibrations involved in hitting a softer tennis ball with a tennis racket, in which the strings provide some dampening effect. And that seems like a good working theory to me. I also noticed that the volleys seem a lot faster than in tennis. It's a lot less running around on the court, so it's more upper body focused, and the players are a lot closer together, so there are a lot more repetitions involved. And the more repetitions involved in an activity, the more it can overload our muscles and tendons, especially the more shock and vibrations that are involved in it. Okay, so what are the symptoms of pickleball elbow? The most common symptom is burning pain at the inner or outer elbow area, which can feel like that little bony knob called the epicondyle is literally on fire. There can also be occasional sharp twinges of pain at either location, which are typically coming from the tendons that attach to those little bony knobs. And there can be tension, weakness, and soreness. They're all very common in the muscles of the forearm, on either side, and sometimes even both sides of the forearm, as well as waking up in the morning feeling very stiff and achy in those areas. Now, clinically speaking, I should point out that there really isn't such a thing as a medical condition known as pickleball elbow. There's tennis elbow, technically lateral epicondylopathy, and there's golfer's elbow, technically medial epicondylopathy. But just between you and me, if it's an elbow injury related to playing pickleball, you can just call it pickleball elbow if you want, since it probably seems weird to call it tennis elbow if you don't play tennis. Again, technically, it's probably tennis elbow if it's your outer elbow area where the tendons of your wrist and finger extensor muscles originate from that little bony knob there called the lateral epicondyle. It's probably golfer's elbow if it's your inner elbow area where the tendons of your wrist and finger flexor muscles originate from that inner bony knob called the medial epicondyle. And just to be clear, we're not talking about the big bony knob at the bottom of the elbow, which is often referred to as the elbow, but rather the little bony knobs on either side of it, which are about the size of the knuckle of your little pinky finger. Before we go further, if you don't already have a good sense of which one you have, tennis or golfer's elbow, or if you have one of these problems at all, I invite you to take my free video mini course called Tennis Elbow 101. In these videos, I'll explain the differences between golfer's and tennis elbow to you and walk you through some simple tests you can do to quickly assess yourself. And I'll include a link on the page below to my site where you can learn more, if you're not already here, and get the free Tennis Elbow 101 video course. Now, assuming you have a pretty good idea that you have either a golfer's elbow or a tennis elbow pickleball injury, what do you do about it? How do you treat it? As far as treatment goes, it doesn't matter what the source of your injury is, pickleball, racquetball, tennis, or golf. You treat your muscles and tendons the same way. There is, of course, the question of how do I prevent recurrences and what exactly may have caused or contributed to my injury. Was it simply playing too much pickleball, suboptimal technique, and so forth? But I leave those questions to the pickleball pros and experts. I'm not a pro or even a player. I'm someone who treats these vexing conditions and teaches people how to treat themselves at home. But I've included a video on pickleball injury prevention and some links to related resources in the article that accompanies this podcast. Now back to treatment, which is what this site is all about. It's critical to begin with the right picture in mind of what this nasty injury is all about, in most cases anyway. The first big hurdle that most sufferers unknowingly trip over is that it's not usually the kind of injury you're often told it is. It's very seldom an acute injury like a tear. And it's hard to know what the exact numbers are, but tears are the problem in only about 1 to 3% of tennis elbow sufferers. It's not an inflammatory condition like tendonitis either. This is something that's also covered in more detail in the free Tennis Elbow 101 video course. And the really good news is that only a small minority of sufferers end up needing surgery. Only about 1 to 3% of tennis elbow sufferers have a surgical procedure because of a severe tear or other serious damage. But it is often a very stubborn chronic injury that far too many sufferers fail to take seriously at first and far too often end up struggling with for months or even years. That's what I'm going to try and help you avoid. So let's get right into why the common wisdom may be common, but it's not so wise. The first thing is knowing that tennis and golfer's elbow, pickleball elbow, is a tendon injury. Usually a tendon injury that turns out to be tendinosis, not to be confused with tendonitis, which is what these injuries are often wrongly assumed to be. Tendinosis is a typically slow, chronic, degenerative condition, whereas tendonitis is an inflammatory condition. I assure you that regardless of how much nasty, burning, searing pain you feel, that pain is usually not coming from inflammation, at least usually not significantly. That's part of the common misunderstanding and why it just seems like a natural assumption that if it feels like burning pain, therefore it's inflamed. No, usually it isn't, at least not past the earliest stage lasting a few days. There is such a thing as chronic inflammation, and that's bad, but this simply isn't one of those cases. The simple truth is that inflammation is a natural, necessary, normal part of your healing process when it comes to healing injured tissues. And that's why trying to chase it away or suppress it by way of the standard treatments is wrong and completely misguided. I have entire articles and videos explaining why icing is wrong, why taking anti-inflammatories is a bad idea, and why getting cortisone shots is a terrible mistake. You'll find links to those in the article if you'd like to learn more. We should also bring up the question of braces, but for a different reason, not having to do with inflammation. The short answer being, it's not the kind of injury you immobilize. So wearing a brace around all day is a really bad idea, regardless of whether it feels better or not. If you want to optimize healing, it's important to allow gentle, normal movement as you go about your day. It is, however, probably a good idea to wear a brace while you're playing pickleball, while you're recovering from your injury. If you decide to keep playing, or for a while when you resume playing. Now I want to point out that if you can see significant swelling, significant visible puffiness, and redness around your elbow area, that's an exception, and it may mean you have an acute injury or a more serious chronic injury, and you may need medical attention and a different treatment approach. But swelling and redness are rare with tennis and golfer's elbow. If 1 minute you're fine and you play pickleball and later your elbow blows up like a balloon, that suggests a more serious acute injury. Tennis elbow and golfer's elbow, however, tend to sneak up on you, gradually getting worse and worse over weeks or months. Although yes, sometimes the pain does appear suddenly, even in the middle of a match. But it doesn't usually swell up. And although it may calm down with pills, ice, wearing a brace, and resting it, if you're still having pain weeks or months later, that's a classic sign of golfer's or tennis elbow. It's a wacky waving, inflatable arm flailing tube man sign that you probably have a chronic tendon injury in the making. Okay, now that we've covered the wrong way, what's the right way to treat pickleball elbow? Instead of immobilizing the area with a brace, we want to mobilize the muscles and tendons involved in our injury with specific manual therapy techniques and gentle stretches. Manual as in hands-on, like the advanced self-massage therapy techniques that I teach. Instead of icing and cooling, we want to warm the area to stimulate circulation and the healing that comes with good blood flow, or at least refrain from freezing our muscles and tendons with ice, which inhibits circulation and can cause cryo damage. We want to allow the inflammation process to do what it's there to do, which is to initiate the healing process, rather than relentlessly trying to suppress it through pills, shots, and ice. Instead of jumping right in with rehab exercises, we delay the start of those exercises. Yes, rehab exercises are an essential part of the recovery process at the right time. But the problem in my experience is that they're often begun too early and end up aggravating rather than being helpful. Our approach here at Tennis Elbow Classroom is to postpone rehab exercise until we first make some progress with the self-massage therapy techniques and stretches, and the worst symptoms have subsided. So those are the broad strokes to start giving you the big picture. And that's all for this episode. But before I go, I want to invite you to come on over to my site, tenniselbowclassroom.com, if you're not already here, where you can read the full article on Pickleball Elbow. Check out my tennis elbow and golfer's elbow self-help programs, and subscribe to that free video course I mentioned earlier, Tennis Elbow 101, where you'll get a crash course on the basics of these stubborn, confusing injuries from someone who's been treating them successfully for the past 15 plus years. Oh, and if you're listening to this on YouTube, iTunes, Stitcher, or some other podcast platform, please subscribe and leave me a rating. Thank you. This is Alan Willett, your tennis elbow tutor, wishing you a speedy recovery. Let's break your vicious cycle.